Hi, my name is Leslie and I'm going to be your nurse today. Anytime we come in and we're going to do anything with a patient, we always want to make sure we introduce ourselves. We always want to verify we have the correct patient with name and date of birth, and that we're verifying their allergies. We're going to provide privacy, give GPSP with the patient's position. We want to make sure today we're doing tracheostomy care. So we want to make sure the patient's in semi-Fowler's position. In this skill, if they are unconscious, they would be sidelined. We always want to assess for pain. If the patient is in pain, we would give pain meds 30 minutes prior. We want to gather all the supplies, make sure we have an order for Trache Care. And when gathering supplies, it's always important to remember we need our hemostat, an oculator, continuous pulse ox is plugged in, an ambu bag is always at bedside in case we was to have an emergency with the trach. So we're then going to wash hands, and we're going to go ahead and drape the patient just in case there would be any secretions while doing tracheostomy care. We're then going to wash hands and we're going to set up our sterile supplies. And then for the sterile saline, we're going to go ahead and open. We're going to lip it in the trash can and go ahead and insert some into our kit and move this out of the way. We're going to apply or wash hands, and then we're going to apply mask and goggles. This is just in case any secretions was to come out while we are doing trach care with the patient. And then we are going to wash hands again, and we're going to apply disposable gloves. So we're going to go ahead and remove the inner cannula, and we're going to remove the dressing. Anytime we remove the inner cannula, we always want to make sure that we are stabilizing the faceplate. Go ahead and remove and dispose. And then we want to go ahead and remove the 4x4. When looking at the 4x4, we want to look and see if there's any drainage, and if there is, the mount, color, odor. We also want to check the stomach, making sure we're checking for signs of infection, bleeding, anything that would be abnormal to the stomach. We're then going to remove disposable gloves, and we're going to go wash hands, and then we're going to apply a sterile set of gloves. And once these are applied, we're going to move this out of the way. We are then going to go ahead and insert the new cannula. And with our hand, we're going to go ahead and make sure that the faceplate is stable. Making sure not to touch the inside of the inner cannula. We're then going to go ahead and we're going to clean the stoma around. So when we do this, we want to make sure that we're doing one gauze or Q-tip at a time, inserting in the saline, and then going from one swipe from inner outer, and then replacing each time new. So we're going to go ahead, dip in the saline. We're going to go from inner to outer, dispose, saline, inner, outer, dispose. Then we're going to pat dry. We're going to do one each time. Dispose. Dispose. And then we're going to go ahead and replace the 4x4. You always want to make sure that you do not cut in the middle insertion. The fibers could go into the stomach. That can lead to an infection. So we're going to go ahead, try not to touch the inside of the 4x4, making sure we are still stabilizing the face plate. We're going to go ahead and insert that. Again, you never want to touch the inside of the inner cannula, as this would break a sterile field. Then once we have the 4x4 in place, we're going to go ahead and change the ties. You can do a 1 or 2 person method. If you're doing a 2 person method, make sure they come over, stabilize the face plate while you're changing that out. With a 1 person method, you will be stabilizing the face plate, and you never want to remove the old collars while we're changing it out with a 1 person. You always want to make sure to do that at the very end. So we're going to go ahead, take our collar. Again, with 1 person technique, we want to leave the old collar on. And making sure we're stabilizing the face plate. Again, make sure we're stabilizing the face plate. And then we would go ahead and remove the old one after it's in place. And once the old one is removed, we always want to check to make sure that the ties are not too tight on the patient. I want to insert 1 finger between the collar and the neck. If it's a little too tight, then I would just readjust it until it's a little bit more comfortable. Like I said, always make sure we're stabilizing the face plate, not to touch the inside of the inner cannula. And whenever we change the collar out with a 1 person, you don't ever want to remove the old collar until you have the new collar placed. You're then going to remove your gloves and any other supplies. At this point, we would go ahead and do a round of hand hygiene. We're going to reassess the patient's pain level, making sure they're okay. We're going to lower the bed back down to a comfortable position for the patient. We're going to give them their call light, make sure they don't need anything. We're going to document the procedure, and then we're going to report.